Okay, so we are in this topic on immunosuppressants, immunomodulators, in that immunosuppressants. And in the last class, we came up to monoclonal antibodies. Let me continue from that and try to complete immunosuppressants and immunostimulants. So, immunomodulators, monoclonal antibodies is one of the very important groups of immunosuppressants. These are all the modern, these are more advanced molecules. So, anti-CD3 monoclonal antibodies, these are the one which are directed at the E chain of the CD3 trimeric molecule adjacent to T receptors on the surface of the T lymphocytes. They have been used with considerable efficacy in human transplantation, basically to reduce the immunity. The original mouse Ig2A anti-human CD3 monoclonal antibody, then moromoid CD3 still is used to reverse the glucocorticoid resistant rejection episodes. What is the mechanism of action? The mechanism of action is moromonab CD3 binds to the E chain of CD3, a component of T cell receptor complex involved in antigen recognition, cell signaling, and cell proliferation. Antibody treatment induces rapid internalization of the T cell receptor, thereby prevents subsequent antigen recognition. So administration of the antibody is followed rapidly by the depletion and extravasation of a majority of T cells from the bloodstream and peripheral lymphoid organs such as lymph cells, lymph nodes, spleen, following the marginalization of the T cells into vascular endothelial walls and redistribution of T cells to non-lymphoid organs such as the lungs. Okay, so moromonab CD3 also reduces the functions of remaining T cells as defined by the lack of IL-2 production and a great reduction in the production of multiple cytokines. Now, therapeutic use of this is indicated in the treatment of acute organ transplant rejection, something like kidney transplant or lung or liver transplant. So, repeated use of moromonab CD3 results in the immunization of the patient against mouse determinant of the antibody, which can neutralize and prevent its immunosuppressive efficacy. What are the toxicities? The majority of the side effects of anti-CD3 therapy is the cytokine release syndrome. Cytokine release syndrome, which typically begins 30 minutes after infusion of the antibody, but it persists for about an hour. So antibody binding to the T cell receptor complex combined with Fc receptor mediated cross linkage is the basis for initial activation property of this agent. The syndrome is attributed to increased serum levels of cytokines, which are released by activated T cells and the monocytes. So production of TNF-alpha has been shown to be a major cause for the toxicity. So there are common clinical features in the toxicity that includes high fever, chills, rigor, headache, tremor, nausea and vomiting, diarrhea, abdominal pain, malaise, myalgia, arthralgia, and generalized weaknesses. So less common complaints include skin reactions and cardiorespiratory CNS disorders, including aseptic meningitis. Okay, so potentially fatal pulmonary edema, acute respiratory distress syndrome, cardiovascular collapse, cardiac arrest, and arrhythmics also have been reported as side effects. So glucocorticoid administration before the injection of moromonab CD3 considerably reduces the first dose reactions, and other toxicities include anti-CD3 therapy like anaphylaxis. See, anaphylaxis is one thing which is very dangerous. and it may be fatal. So the neoplasm associated with immunosuppressive therapy, and there will be rebound rejection also has been observed with Morabanab CD3 treatment once it is stopped. Okay, rebound will generally say that once the treatment is stopped. Now other drugs, anti-IL-2 receptor antibodies, declizumab, declizumab. So declizumab is humanized murine complementary determining the region human LG1 chimeric monoclonal antibody, and basiliximab is a murine human chimeric monoclonal antibody produced by recombinant DNA technology. So declizumab consists of human constant domain of IG1 and variable framework region of EU myeloma antibody and murine CD3 anti-TAC antibody. Okay, how does it act? The exact mechanism action of anti-CD25 antibodies is not completely understood, but the likely results from binding of the anti-CD25 antibodies to the IL-2 receptor on the surface is activated. Significant depletion of T cells does not appear to play a major role in the mechanism action of these antibodies. Therapeutic use. Declizumab and basiliximab are used for the prophylaxis of acute organ rejection in patients. Now, declizumab has been used with maintenance immunosuppression regimes, especially maintenance of the immunosuppressive regimes like cyclosporine, azathioprine, glucocorticoids, cyclosporine, glucocorticoids. All these are immunosuppressive dose. And with maintenance, triple regime therapy, either a cyclosporine or tacrolimus or glucocorticoids and mycophenates, mofetil, substituting that of the azathioprine. Okay, so what are the toxicities? There is no incidence of cytokine release syndrome with these antibodies, but the possibility of anaphylaxis is always there. And lymphoproliferative disorders, opportunistic infections may also occur, and one need to be cautious with that. Okay, with that, I have almost completed that of the immunosuppression. Let's now go to immunostimulation. What is immunostimulation? See, in immunosuppression, you ensure that immunity is below limits so that there is no organ rejection happens. But whereas in immunosuppression inhibits the immune response in transplant rejection and autoimmunity, but whereas in immunostimulatory, the immunity boosts up so that person is not susceptible for infections. Okay, so some of the immunostimulation drugs are Levamisole. This is synthesized originally as anthelmintic, but it is used to restore depressed immune functions of beta lymphocytes, T lymphocytes, monocytes, and macrophages. Its only clinical indication is as adjuvant therapy with 5-fluorouracil after surgical interventions in the colon cancer. It is occasionally used. It's been occasionally used with occasionally associated with agranulocytosis. It means agranulocytosis is one of its side effects. Thalidomide. Have you heard of thalidomide? Is one of the very famous drug which was used to cause severe birth defect, and maybe long time back in 60s it was dumped, but it has come back to resurrected back for the treatment of erythema, nodosum, leprosy patients. And it is also used in multiple myelomas, and it is now as an amazing savior drugs as an immunostimulant drug. Okay. Now let's get into cytokines, recombinant cytokines. Interferons, though initially were identified by their antiviral properties, activities, these agents have important immunomodulatory activities. So interferons bind to specific cell surface receptors that initiate a series of intracellular events. So induction of certain enzymes, inhibition of cell proliferation, and enhancement of immune activities, including increased phagocytosis by macrophages and augmentation of specific cytotoxicity by T lymphocytes. So these recombinant interferon alpha 2b is obtained by recombinant expression of E. coli. Interferon alpha 2b is indicated in the treatment of a variety of tumors, including hairy cell leukemia, malignant myeloma, follicular lymphoma, and AIDS-related capsocell sarcoma. So it is also indicated for chronic hepatitis B infection, then condylomata acuminata. It is supplied with combination, it's supplied in combination with ribavirin, ribavirin, one of excellent antiviral drug for the treatment of chronic hepatitis C. So it is given along with ribavirin for the treatment of hepatitis C with compensated liver functions not treated previously with interferon alpha 2b. Now, adverse reactions are flu-like syndromes, all this fever, chills, headache, and the most common adverse effect after interferon alpha 2b administration are basically flu-like syndromes. Other adverse reactions may be cardiovascular, like hypertension, arrhythmia, cardiomyopathy, and myocardial infarctions. CNS effects are depression, confusions, maybe not as much. Now, interferon gamma 1b is a recombinant polypeptide, activates phagocytes and induces their generation of oxygen metabolites that are toxic to a number of microorganisms. It is indicated to reduce the frequency and severity of serious infections associated with chronic granulomatous diseases. The adverse reactions include fever, headache, rash, fatigue, GI distress, anorexia, weight loss, myalgia, and depression. Now, interferon beta 1a. These are the recombinant glycoproteins, and interferon beta 1b. These are recombinant proteins having antiviral and immunomodulatory properties. Okay, these are FDA approved for the treatment of relapsing and relapsing-remitting multiple sclerosis to reduce the frequency of clinical exacerbations. The mechanism action is in multiple sclerosis is not clear, but it is definitely used in multiple sclerosis. The adverse reactions of these interferons of 1B, 1A interferon adverse reactions are the flu-like syndromes and also pain at the site of infection. Okay, immunization. You are all very familiar with immunization. Immunization, there are two types of immunization, active immunization and passive immunization. So active immunization involves the stimulation of an antigen to develop immunologic defense against a future exposure. So what do you give in active immunization? You give an antigen. What do you give in passive immunization? You give an antibody. So while passive immunization involves administration of preformed antibodies to an individual who is already exposed, so it is generally given as a therapeutic drug. Whereas in case of active immunization, antigen is given as a prophylactic drug. So vaccines are active immunizations. Vaccination involves administration of antigen as a whole or killed organism or attenuated organism or a specific protein or peptide constituent of an organism. Anybody remember a protein or a peptide constituent of an organism used as vaccine? Anyone remember? Somewhere 6 of you are there. Archana,
No, sir.
BCG. You studied that? No. Tuberculosis vaccine is a
Yes, sir.
protein. Is a protein. You studied that in a second year from microbiology.
Yes, sir.
Okay. And do you remember any of this killed organism?
Sir?
Killed organism as a vaccine. Killed or attenuated. Attenuation is live organism whose pathogenicity is not there, but antigenicity is there. Okay. Cholera organism, typhoid organism. These are all vaccines. These are all attenuated or killed organisms. Okay. So remember now all the children, so many vaccinations have become mandatory. BCG also is given for children. Polio is given. Polio vaccination is a viral vaccination, isn't it? Okay, so BCG, polio, so many vaccines have become mandatory now. Okay, so why you need booster doses? Many times to the children at the age of 1 month they give, then at the age of 5 months or 2 years or 3 years, one more dose is given. Booster doses often required, especially when killed, that is inactivated organisms are used as immunogens. So vaccination has sharply curtailed the practically or many, the vaccination has been a great boon. It has totally eliminated some of the major infections like polio. In many countries, polio is not there. Smallpox is not there. Diphtheria is not there. Measles. Now you give triple vaccination, isn't it? What is the triple vaccination? Measles, mumps, then pertussis, rubella, tetanus, Haemophilus influenza, pneumococcus, all these are essential vaccination which has literally has transformed the health condition of this nation, and people are no longer sick now. Okay, now most of the vaccinations have targeted infectious disease, but there are new generation vaccines may provide complete or limited protection for specific cancers or even autoimmune disease. This is a new line of thinking. Many of these cancers or autoimmune disease, they are developing some proteins which can act as vaccines and prevent the inception of these things. There is an efficacy of DNA vaccines in the models of infectious disease and cancers. The advantage of DNA vaccination or peptide immunization is that it permits the generation of entire proteins, enabling determinant selection to occur in the host without having to restrict immunization to patients bearing HLA alleles. See, one more approach is to generate or enhance immune responses against specific antigens consisting of infecting cells with recombinant vaccines that encodes the protein antigens of the interest. So these are all, many vaccines are now already available in the market. Now let me just briefly tell you about immunoglobulins. Now vaccines are active immunization. Immunoglobulin is passive immunization. How is immunoglobulin produced? When a vaccine, that is an antigen, has an active antigenicity and it produces antibodies to fight against the antigen. So, have you studied for the process of making antibodies in your microbiology? Yes or no? You have forgotten all those things. No? I remember teaching this to my B Pharm second year students maybe 20 years back. It is there for a long time. You remember we give to the horse antigen and the blood is collected and the antibody separated out. Any of you remember that?
No, sir. Studied
No.
in second year B Pharm as well.
Correct. So you why did you say you don't know? It is you studied, isn't it? I'm also
Yes, sir,
remembering.
but forgot.
I'm also remembering from second year B Pharm only. Okay. So
Okay, sir.
passive immunization. Passive immunization is indicated when individuals is deficient in antibodies because already disease has started. The acquired immunodeficiency, there is or disease has started, but he does not have required antibodies. So we have to take an antibodies from outside, inject antibodies so that these antibodies will fight against the antigens that have already entered inside the body and kill those antibodies. So we need a larger quantity of antibodies. So an individual with high degree of risk is exposed to an agent, there is inadequate time for active immunization. That means already measles is set in, already rabies is set in, hepatitis B is set in. You cannot give a vaccine of these things because these takes time to convert antigen into antibody. And that is why when the disease is already present and you need to give antibodies to them. See, now when you go meet with a bike accident, then you have scratches everywhere in the body. What do they do? What do they do? They give you tetanus vaccine, isn't it? Tetanus. So there are many immune globulin intervention that these are hepatitis B immunoglobulin, rabies immunoglobulin, tetanus immunoglobulin. These immunoglobulin are the antibodies that prevent the antibody actions. Okay, so with this I complete this topic on the immunomodulations. Okay, my next learning is going to be, my must teaching is going will be on the what is that, it is on asthma. Okay, so now I cannot switch over and record this and that, so I will record that separately, and maybe I will call for a class little later on, and that time I'll be doing exclusively asthma. I just was talking to Archana, I want you to make the questions out of each chapter. Okay. Now,
Okay, sir.
Archana, can you allot to the various students? I want you to message me who will be identifying the questions from which chapter. How many
Okay,
of you
sir.
are there in the class?
Total, sir? 13.
Oh, that means out of 13, only 6 come to the class.
Yes, sir.
Very sad. Okay. Anyhow, you send me the assignment that you given to various friends, or who will be collecting the questions on which chapter. Okay.
Okay. Okay,
And
sir.
in the next 10 days time, I want, or let next one, by next Monday. Okay, 10 days is too much. By next Monday, I want all of that to be collected. And if anybody has not submitted by next Monday, we will take an action on the students. Okay. Why do we need this question bank? Question bank will only give us a guidance as to how we have to prepare in the examinations for these topics and what are the general emphasis in the examination on various topics. Okay, so we will revise later on the basis of the question bank. Is that clear?
Yes, sir.
Okay, Archana, you send me the attendance and
Okay,
I
sir.
will stop the class with this, and next class we will study the asthma. Okay.
Yes, sir.
Okay, ma. Thank you.